At our recently concluded reunion, my class and I listened to Dr. Chika Anireto speak to us about the topic, Now That You Are 45. Now That You Are 45 by Dr. Chika Anireto. Listen in.
You have some aches and pains, maybe it's spondylosis, which is like arthritis, but when it happens to the back. And then you begin to notice you're not as flexible as you used to be. Maybe you used to be able to touch your toes, and now it's like, oh my goodness. And for the women, reduced fertility, that's a huge one. Before now, it was, I don't want to get pregnant, no. And then all of a sudden, it's like, oh my goodness, so that's going to just go. So we have the perimenopausal years. So during perimenopause, you see mood changes. You might become a bit more irritable, a bit more easily upset by things that wouldn't ruffle your feathers before now. You might even notice changes in the menstrual cycle. For some people, it becomes heavier, it becomes more frequent, and you're wondering what's going on. Then for some people, menopause may have already set in, and you're feeling changes in your cycle. Maybe it's gone. In addition to that, aches and pains that weren't there before. Then what about andropause? So it is not exactly equivalent to menopause for men. There's a difference. So for women, fertility goes, it doesn't return. But for men, andropause means a gradual decline in testosterone levels. Not just the testosterone, all the androgens, hormones associated with maleness, that are responsible for the aggressiveness that men have, for the drive that men have, for the libido, for the hair production, the kind of facial hair that men have. As men get older, typically from 30s actually, but it's not really noticeable until 40s, 50s, you notice a decline in these androgens. So unlike female menopause, the man doesn't completely become infertile. That's not true. But the rate of fertility or the level of fertility does decline, but it's not the same as women. And not every man even notices these changes as much as other people, but it's something to take note of. In case you're wondering why maybe there's some erectile dysfunction, maybe you're not able to keep it up for as long as you used to before, maybe the number of times you could meet with your wife was more frequent before. These are age-related changes, but I'm here to tell you that it's not as though age happens and you just sit and accept, which is what some people do. I'm getting older. There's something you can do to age gracefully. That means slow down the aging, be as healthy as you can at each stage of your life, and maximize potential at each stage. So other than andropause, there's also weight gain, men and women. The fat just won't go the way it used to go. It just won't burn. You do the same things you've always done. You eat the same food. You're exercising as your lifestyle is basically the same. Can you hear me? Yes. But the weight just becomes a bit sticky, especially abdominal fats. Now the problem with abdominal fats, talking about the pot bellies, both men and women, is that is the bad fat, quote and unquote. That's the one associated with diabetes especially. That's the one associated with cardiovascular diseases. Why is it that it becomes so prominent at this time of life? It is because of those hormones in men and in women. So for women, the loss of estrogen causes a redistribution of fat. So fat that used to hang out in your hips before just kind of migrate to your tummy, and all of a sudden you're looking different to yourself in the mirror. For the men as well, it's more common in men because men have more muscle bulk. So as a man gets older, muscles begin to reduce, and for men and women, but it's more noticeable in men because they have more muscle bulk than women. And because muscles tend to burn calories faster than fat, calories are burned faster than muscles than any other tissue. So when the muscles go, the fat redistributes itself towards the top. So this is the reason for this abdominal, gathering or location of fat that occurs in middle age. Can you hear me? Yes. And there's a gradual muscle loss as well. From the age of 30, about 5% with each decade of muscle begins to reduce. So that is why when people get older, it's like they're shrinking. And I didn't even mention the height. So because of the spondylosis, that means the intervertebral discs, the disc between the vertebral bones begins to And some people, towards the neck, it begins to hunch a little bit. So you see this old age posture. So this presentation is all about what you can do to slow down as much as possible and age gracefully, so that some people actually get to look more beautiful as they age and more handsome as they age. This is what this presentation is all about. If you do nothing, if you keep doing what you've always done, what will happen is you just get bigger, abdominal fat will increase, you just get a bit shorter, and things like that. And with the abdominal fat comes the cardiovascular illnesses, comes the diabetes and the rest of them that we don't want to hear at all. Next slide. Okay, so I've talked about the health, the physical health challenges. What about the psychosocial? What about the cognitive? So, cognitively speaking, in terms of ability to process information, we also tend to slow down as we get older. Working memory capacity. Working memory is that memory that helps you to hold on to things in your mind. Like you want to do 2 plus 2. So you, in your mind, the 2 is there, the plus 2 is there, and you don't need to write it down. You figure out in your mind. That's working memory. So that capacity, the number of stuff you're able to hold in your memory at a time begins to decline as we get older, especially after 50. Ability to process information. So you understood new information like that before. Now all of a sudden it's like, slow down, what did you say? Can you take it easy? Because we are aging. Difficulty with recall. I had a conversation with my son yesterday, and he said, Mommy, I got my forgetfulness from you. I was like, what, me? Forgetfulness? No! It's like, that's why you have a dozen reminders in your phone. I'm like, oh, whatever. So, the point is that as we age, we don't recall information the way we used to. And it becomes noticeable. So it starts from our 30s, but it becomes noticeable in our 40s, 45, 50s. But there is individual variability. It's not a hard and fast anything. It all depends. Remember at the beginning I said there is a lot of variability in terms of how you live your life. The things you do, sleep, exercise, food, things like that, family history and the rest of them. But I'm concerned with the things within our control. Then family and relationships. Middle age is the time when care for your your older children and your aged parents is important. So we are at the sandwich space where you're in between, you're handling your kids, you're handling your old aged parents, and you have to, sort out your career while you're doing all that. So in addition to all that, there's stress, some people face burnout, and sometimes there's masking. So masking is where you don't show up as your authentic self. And this is what a lot of us do. What it means is you wear a mask and show up the way you perceive you're expected to show up. So if you're in an environment where people are chatty, you become chatty. If you're in an environment where people are more reserved, you become more reserved. So you're a bit like a chameleon. You're not being who you really are. So the problem with this is that it leads to exhaustion and causes, increases stress and burnout. Marital stress as well. This is the time when midlife crisis could occur. So midlife crisis is not a diagnosis according to DSM-5 or anything like that. It's just a collection of symptoms that tend to happen at this time of life. And why it happens is because you are old enough to have self-esteem, you know who you are, you're self-aware, your goals are in front of you, your values are clearer. So you begin to reevaluate your life and say to yourself, is this what I want to do? Am I in the right career? Am I with the right person? Why am I living with this man? I'm not even happy, or this woman. So when the questions like this arise, it's almost like a crisis. You're beginning to wonder whether I am not making a mistake in my career, with my relationship, in my children. And this is the time where for women, you begin to see things like, I want to do plastic surgery. It's almost like you're fighting to retain your youth, to retain time to do what you think you need to do with your life. So you see, flash decisions are being made. Men would buy flashy cars. I never really enjoyed myself all my life. My life is passing me by, and we go and buy a Lamborghini and then break the bank. So things like that happen at this time of life. So for women, things like body image becomes really important. Plastic surgery, people are doing tummy tucks, people are doing all sorts of things to actualize their dream. It's almost like I'm getting older, whatever I need to do, this is the time I need to do this now. And for men, relationship with younger women tend to occur because it boosts their self-esteem. It tells them, you still got it. And then you see things like this happening. And of course, with the stress it puts on your primary relationship with your spouse. So career, I talked about reevaluation. This is where people sit down and say, I'm not doing what I've always wanted to do. I'm going to change. I'm going to follow my passion. I've always done this for my parents, for this reason, for that reason. Now my kids are older, boarding school, university. Now I'm going to do me. I'm going to pursue what I want to do. This is the time it happens. According to a psychologist, American psychologist called Erickson, this is the time when the crisis of generativity versus stagnation sets in. Excuse me. So generativity means I want to leave a legacy. What will I be remembered for? What will I leave for my children? What will I leave for the younger generation? What impact have I made in the lives of these people? How have I been impactful in the lives of the younger people? And this is the time where people begin to build, things that outlive them. They begin to put in place things that when they're gone, they will say, oh, we knew to look for this. Oh, we knew how to do this. This is our niche. Then people who are not able to achieve that, this is a time when there's regrets, there's despair, they feel like they're stuck, they feel like they're not moving on, like their life has just, been a waste. So this is the stage where this happens, where people begin to think of what happens after they're gone. And finally, some people are afraid of getting old. Some people feel as if there's a time bomb ticking. I have no time. All my life I've worked for my parents, for my children, for my husband. I have no time to do what I've always wanted to do. And who even knows? Maybe you lost someone, maybe someone, a classmate or a family member about your age has died, and then you realize your mortality and you become afraid of dying and getting older. And you realize that, oh, I've wasted a lot of time. But it's not all gloom and doom. There's some perks to getting older. Improve social skills, especially our generation. We were alive before the internet. We were alive before social media. We learned to play outside with one another. We developed social skills. We know how to relate. Quite unlike, if I might add, the younger generation. I went through a study once that said that Gen Zs, that is the people that are 25 and below, they are able to recognize emotions better on emojis than on human faces. So when they are typing, they can do all their shortcuts and all that, and then they are sending emojis. But because they have always, all their life they've had the internet, all their life they've had these gadgets. So they relate better with gadgets and screens than they do with actual humans. So that's the perk of being middle-aged at this time, because we are experts at social skills. We've been doing that all our lives. Social media just came to enhance it. We have the basic foundation of knowing how to communicate with one another, and we can teach it to the next generation. Increase emotional maturity. So that's a perk of being middle-aged. You are gone past the things that would cause crisis. Sometimes my daughter would call and she would say, and she's in tears and she's emotional. She's in university second year. And what's the problem? My friends, she called their name, which I know. They went for a party without me. Can you imagine? She's so upset. I'm like, calm down. What does that mean? They don't like me anymore. When they group, why they do this? So I'm like trying to calm her down. But remember when you were just as intensely, distressed like things like this. But with age, things don't phase us so much. A lot of emotional maturity. Things happen, you're like, okay, it could be worse. You're alive, be grateful, be grateful. So emotional maturity. Increase independence. We're at the age where a lot of us have financial strength to do what we want to do. We don't need permission from anyone. We don't need to have people, grant us the permission to do what we want to do. So with financial independence comes the ability to pursue your personal interests. This is why this is the stage where that generativity versus stagnation happens. Because all of a sudden you have these resources at your beck and call, and then you look up and look, what have I been doing all this for? Increase self-esteem. I once gave a talk to teenagers, and it was about how during the teenage years, and by the way, my dissertation was on self-esteem, so I want, if you permit me, to say a bit about self-esteem. So if we are to plot a graph of the self-esteem of human beings generally across the lifespan, we'll find out that during the teenage years, there's an all-time low in self-esteem. That is sense of self-worth, sense of I'm good enough, I am able, I'm capable, I got this, is an all-time low. So forgive your teens when they are, shaken apart by things like that, because this is the age where this thing happens. But in middle age, so after that age, in middle age, 45, 50, 60, that is when self-esteem is at an all-time high. You know who you are. No one can come and say, you're not good enough, yeah, whatever, that's your opinion, not mine. That's you do you, I do me. So that is a part of being older. You're more secure, more self-aware, more self-accepting. So you see yourself, warts and all, and you accept all of you. Shift in values. So at this age, there's also an increased sense of purpose. We are not just working for applause or comments or likes. We are doing things you're doing because, this is impactful, this is meaningful, this is my passion, this is what I want to do, this will make, impact and touch lives. So talking about physical health, before we go into cognitive and psychosocial health, what are the things we could do to keep these bodies of ours strong as possible? So one thing is the periodic health check. So notice I said periodic, not annual health check. Annual health check is the one you do every year. Periodic health check means you do this test when you notice a shift from the norm. So there are some routine tests that are supposed to be done at different ages, and depending on the frequency and your personal history, that are done routinely, and then some that are done, periodically. So starting from the history, so you go and see a doctor and you say, I want to do a periodic health check. First thing they'll do is they'll take a history. The usual history, but the emphasis will be on your personal history. What has life been like for you? Do you have any medical conditions right now? Has anyone ever said that your blood pressure was high? Has your blood sugar ever been high? Have you fallen before? Any fractures, things like that? And then family history. Family history of, high blood pressure, diabetes, cardiovascular illness, and things like that. Social history. This is where your lifestyle is x-rayed. Do you do physical activity? How often? What are you eating? Vegetables and fruits? Do you smoke? Do you drink? How often? Are you sleeping well? Things like that. Then you're also screened for mood disorders. So in Nigeria, 1 in every 4 Nigerians has a mental illness. So we think it's far away from us, but it's right here actually. In fact, there's a silent epidemic, just to say, of mental illness going on, even in our own country. So all these things are screened during your periodic health check. Mood disorders, burnout, and then the physical comes in. Amongst everything else the specifics are your body mass index. So there is a myth that your body mass index should naturally increase as you get older. That's a myth, it's not true. If you are overweight or obese, you are at risk of certain things regardless of how old you are. Same thing with blood pressure. There's a myth, it used to be true, or we thought it was true until it was discovered from the mice control trial that it was false. People used to say that, blood pressure of 150, 90, and 55 is not bad. It's not true. The truth is, no matter how old you are, if your blood pressure is above the norm, so we have the upper limit before you contact with anyone, 140, 90 and above. But it doesn't mean that because your blood pressure is 130 that it's okay. It's not okay. The optimal blood pressure is 120/80, less than 120/80. So if you are 45, 50, however old you are as a middle-aged person, and your blood pressure is not less than 120/80, you need to start working. Don't wait for it to become 130-something, 140-something, and then you begin to work. You can actually do a lot about it by yourself. So exams of your cardiovascular system, musculoskeletal system, your height. So people say sometimes, middle-aged patients of mine, why are you measuring my height? Am I decreasing? I'm like, I'll explain what I'm doing. And the reason is what I told you earlier. There is a gradual reduction, and sometimes it could even be a mid-thoracic fracture. Compression fracture of the mid-spine, and it's asymptomatic, and people are going around, you don't really know. It could be a telltale sign of osteoporosis. So minus the menopause, even the andropause can cause osteoporosis in men. There are physical conditions that make our bones thinner than they are supposed to be. So take people like with COPD that have to be on steroids. So steroids will thin your bones. People that have digestive issues, Crohn's disease and things like that. they are not able to absorb some of these calcium and vitamin D, so their bones are thinner. So in people like that, you will see a reduction in height, which we make note of. And then if you do a DEXA scan, which is to check for the strength or the how brittle the bone is, you will see that it's reduced. There's something you can do. You don't have to wait until a minor trauma breaks your bones and then you say, oh my God, I had a fracture at 55 or whatever. There is something you can do. Quite a few of my patients are on yearly either insulin acid that we do to strengthen bones and vitamin D and things like that. So the usual labs that you're all familiar with, blood count, blood sugar, A1C, SCI screen, eye and dental check, glaucoma screening if you have a family history of glaucoma, because it's the commonest cause of painless loss of vision. So let's be more specific. That was general. What about for men specifically? So it would be very important for you to check your stool every year or every 2 years, depending on the guideline you're following. But I do every year to look for microscopic traces of blood, which will give us an example, an idea of what your colon health is like. So if you are 45, it used to be 50, but it's been brought downwards because they found out that colon cancer is becoming more and more common in younger and younger people. So once you're 45, you're due for your colonoscopy. And the good thing is that once you do it, you don't have to do it again for the next 10 years. Thyroid function tests, thyroid stimulating hormone screens, prostate scan. So I'll say a bit about prostate scan. Canadian and American guidelines will tell you that you should start screening for the prostate at 55. But they are white. African American people, black people like ourselves, we are at a higher risk of prostate issues, so we screen earlier. We screen from 40 even to 45. So we do PSAs, we do digital rectal exam. So sometimes we interpret these guidelines and we have to be specific to our own population. For those who smoke, if you've been smoking more than 20 years, about a pack a day, you need to do a low-dose CT to screen your chest, not only for lung diseases but for cancer. Vitamin D screen. So vitamin D screen is not in any guideline, but it's something I do because from experience, a lot of us are vitamin D deficient. Why? We're black women. Our melanin will not allow our skin to process the sunlight and produce vitamin D. Plus, we don't even like to go out in the sun to start with. So not only are we avoidant of the sun, because of the harmful UV rays and what they do, so we are typically vitamin D deficient. So vitamin D deficiency increases the risk of low mood. So from a psychotherapist perspective, I don't make a diagnosis of any mood disorder unless I've seen vitamin D, so that I don't treat something that is medical and I say it's a therapeutic, psychotherapy. So DEXA scan. So this is in people that have signs of osteoporosis, maybe bone pain. Some patients will say, my whole body is paining me. It may not necessarily be malaria, or you slept badly. It may be osteoporosis, depending on the age and the history of that person. Spirometry is not a routine for everyone. It depends on specific history. So if you have chronic obstructive pulmonary disease, lung disease, then you should do a lung function test or spirometry. The abdominal aortic aneurysm screen is not done for people from 40 to 60. It's done for people above 65 years. But if you have a family history, I will screen you even if you're not up to 60. And the reason is that there is no never say never. If you've had someone die from aortic aneurysm, it is such a sudden catastrophic death. Before you turn around, the person is gone, and there's something you have done about it. So echo yearly if you're hypertensive, coronary artery, scan, CT scan, if you have cardiovascular disease or risk of it, cancer screen if you have a family history. So we don't do cancer screen for everyone, just for doing sake. If there's a family history of some relation that had ovarian cancer, breast cancer, so if someone has breast cancer, for instance, it doesn't necessarily mean that you are at risk of having breast cancer. It just means that you are at risk of having any other estrogen-dependent cancer. So you are at risk of having colon cancer, you are at risk of having endometrial cancer, not that you must have breast cancer. So that's what I mean by family history. So for the women, we know about the mammals, once you're 40 and above, once or twice a year, depending on your risk. Once every year or every 2 years, or more frequently, depending on your risk. Pelvic exam. So speculum is inserted, we look at the cervix, we are examine the adnexae, that is the ovaries, and we're looking for cysts, we're looking for ovarian tumors that tend to be more prevalent at this age group. Pap smears, we know every 3 years. If you are average risk, if you're at higher risk, then you need more frequently. We can do pap smear and HPV testing so that you do it every 5 years. And it will stop at the age of 65 if you've had normal scans after that. So all these other tests are the tests we'll do for women between 40 to 60 years. Same essentially as the men. Don't forget the vaccines. So there are vaccines as well that we should have gotten, or we should get if we've not already gotten them. Number one on my list is the human papillomavirus vaccine. It's either you get the Cervarix or you get the Gardasil. So you can get the Gardasil even if you're a woman because it covers, protects you against more serotypes of the human papillomavirus. So that you're not only protected against cervical cancer, you're protected against cancer of the vulva, cancer of the vagina, and warts and things like that. So for special populations, vaccines are important as well. So if you have sickle cell disease, if you have heart disease, you have had your spleen removed, you have lung disease and liver disease, you will benefit from these vaccines beyond the regular vaccines. If you had herpes before, you need not the genital herpes, I mean the simplex, then you need to have the vaccine to prevent you from having it again, or to prevent you from having complications from it. Hepatitis B vaccine. So I know this is a childhood vaccine, but I put it on this list because unfortunately, we are taught that it is a lifetime vaccine, but from experience, it doesn't last for a lifetime. It wanes with time. But this is not something I do routinely. If you have a history, maybe your spouse has hepatitis B, then I'll definitely screen you and make sure you have developed immunity. So beyond the hepatitis B, so this antigen, I would look for antibody titers to make sure you still have immunity so that you are not at risk of having hepatitis B. All right, so what are the nitty-gritties of the lifestyle? I mentioned that at different times during this talk. Exercise. So if you are not overweight and weight loss is not your goal, your BMI is optimal, you should aim for about 30 minutes of aerobic physical activity, about 4 to 5 times a week. And it mustn't be a 30 minutes as a stretch. So you can do 10, 15 minutes sometime, 15 minutes another time, 10 minutes sometime, 10, 10, 10, however you like, as long as in 24 hours, you've moved around for about 30 minutes. Now, when I say exercise, I'm talking about aerobic, but there are different types of exercise. Remember I talked about the muscle, waning, the reduction of muscle bulk. So at this age, we should be doing beyond aerobic exercise. You should lift some weights so that you can delay that muscle loss that happens at this age. So for the men, if you like, you do the dumbbells. For the women, you do the yoga with the dumbbells, you do Pilates, they strengthen. Not as well as resistance training, like carrying the weights, but they do actually, firm up the muscles and actually help to cause muscle growth and keep the muscle bulk there. So we talked about aerobic exercise, we talked about resistance training, strength building, then there is the flexibility. So don't discount the stretches, don't discount the yoga. I actually I had a patient with sickle cell and I prescribed yoga to boost the circulation and reduce the frequency of crisis. I found it, I read it up once, I'm like, why do you do that? So exercise beyond the aerobics, the strength, the flexibility, all these things, and then balancing as well. So as we age, remember I talked about cognitive changes. So our ability to sense balance reduces. So likelihood, increased likelihood of falls. So the exercise routine you have, be sure that you incorporate some strength training, some aerobic training, some flexibility. So I would prescribe warm-up before you start, do the aerobics. While you're doing the aerobics, carry the weight. If you are walking, carry the weight so that you can kill 2 birds with 1 stone. And then when you're done, end up with the stretches, and that's like a well-rounded exercise. While you're doing it, stand on one leg to help with the balance and stuff like that. Exercise. If you need to lose weight, then the 30 minutes aerobic does not apply to you. We're now looking for 1 hour aerobic activity, in addition to everything else I mentioned. So 1 hour, you need to do that about 4 to 5 times a week if you want to see some weight gain, weight loss. So I talked about exercise. Next, diet. So there's actually a plate there. This we all should be eating at this point. Not even only at this point, this is how everyone should eat actually. So if you were to divide your plate into 4 portions, an entire half would be vegetables and fruits. The remaining entire half, if you divide it into 2, 1/4 would be carbohydrates. Carbohydrates, we have the complex versus the simple. Complex preferably. Why? Because the body uses energy to break down complex carbohydrates, and it's not hard to get. Beans is a complex carbohydrates. Brown bread is not as tasty, but it's healthier. Brown anything, brown rice, brown spaghetti, it's more of a complex carb. If you really want to go there, you can do the lentils, you can do the quinoa. Some people tell me I don't like the taste. You can spice it up, mix it up, chop chicken, chop fish, chop the vegetables, make it tasty. Then the lower half will not have the protein. So we prefer white meat to red meat. So the white meat is the fish and the chicken, and the red meat is the beef, the goat, the intestine, the everything else. So white is preferable because it gives you less cholesterol than the red. So that's about diet. So with every meal, we aim to have fruits and veg with every single meal. That's the DASH diet. And if you do that, the advantage is that those antioxidants I mentioned at the beginning that would help to neutralize the free radicals, that are the natural exhaust of the body, are present in the food you eat. And all the things I've said, especially fruits and veg, they have all these antioxidants and will keep you healthy. Adequate sleep. Can you hear me?
Yeah.
So adequate sleep. So sleep is crucial. Everything is worsened by lack of sleep. Physical ailments are worsened when the person is not sleeping. Psychological ailments are worsened when the person is not sleeping. In fact, they can even precipitate something in someone who is predisposed to lack of sleep. So sleep is huge. So how much sleep do we need? Very good question. So anywhere from 7 hours. Yeah, 7 hours. From 7 hours to 9 hours, so the literature says. And the literature will also say that a lot of people don't even get up to 6 hours a day. But it's not only that the sleep it's not only the length or the duration of the sleep, it's the quality of the sleep. So some people sleep and the sleep is shallow and they wake up unrefreshed and still stressed. I want to point out something. Sleep can retard your weight loss efforts. If you're not sleeping well and you're doing especially very rigorous exercise, you are increasing cortisol, by the way, and you're not sleeping well, it might actually, upturn all your efforts and you end up gaining weight and you're wondering why cortisol. So that's why sleep is important. And when we sleep, we actually, recharge our batteries. The body is better able to make these antioxidants with the fuel that you've given it when you sleep better. So sleep medicine is a whole new branch altogether. But telltale tips on how to get good sleep is the sleep hygiene. That is, see if you can sleep and wake up around the same time every day. Have a routine, a nighttime routine that would tell your body and your mind that we're rounding up now, and it has to be the same routine in the same order every night. For instance, you go for a walk, you have a bath, you say your prayers, you go to sleep. Every night you go to a walk, you have your bath, you say do it in the same order and sleep around the same time. The chances that you feel sleepy are higher if you keep a routine. In addition to, so you did this and you still didn't sleep, wake up at the same time you would the next morning. It increases the sleep drive. That is your tendency that you will sleep that night. If you stay in bed trying to forcefully get to sleep, there's a reduced chance that you'll sleep. So it's a bit paradoxical, but it works. Water intake. So we need about 2 to 3 liters of water every day just to get our bodies running. You all know that our bodies are large percent of our bodies water. Substances. So this merits mention because with all the stress that is going on in our lives, it is understandable that people need a bit of help to calm down, to reduce anxiety. So smoking, weed, alcohol, a bit of help here and there. But if I use alcohol as an example, we now know that no amount of alcohol is 100% safe. So we move beyond how many glasses, how many meals, whether it's alcohol, whether it's beer or spirits too. You know what, don't drink it at all if you can help it. Any quantity of alcohol has some deleterious effect. Spirituality. So it is part of lifestyle. We are spiritual people. So spirituality, research has shown over and over again the importance of spirituality in our lives. It gives meaning to our lives. In midlife crisis, I mentioned, people who are spiritual tend to have that less, because there's a meaning, there's a sense of purpose. And even after surgery, they recover faster. People who believe in God, and the God can be, whether you're Muslim, whether you're Christian, just believe. So spirituality is huge in terms of lifestyle. Reduces all the stress hormones that we talked about. In fact, when I talk about stress management, I mention spirituality. Because in practice, I have seen patients who were at the boundary between life and death, talking about suicidal, and it was spirituality that was the only thing holding them back from living their life. So it's important. Sexual intimacy. So that merits mention as well. So it's part of when we say lifestyle. All these things is what we mean when we say lifestyle. So for men especially, sexual intimacy, because men tend to have the touch as their love language. So if I'm not touching you, I'm not seeing you, it's hard for me to feel love or express my love for you, talking from a man's perspective. Am I wrong, men?
Come again. Come again.
I said that from my experience. Men tend to have touch as their love language. And I said, am I wrong? I'm correct. Yeah, I've seen that a lot. So there's no study, I'm not quoting any study, I'm just quoting experience. So I'm just trying to emphasize. Thank you. So we have some witnesses. So sexual intimacy is very important. And as much as because of what we said about women, the perimenopause, some people lubrication around the genital area is not the way it used to be, there tends to be an imbalance or a discordance between a man and his wife at this area. While the men are still going strong, women are like, oh, gotta calm down. And then there is this dysfunction. But when I go on, we'll talk a bit about how to kind of spice up things relationship-wise. So addressing the physical health challenges. So I've mentioned the challenges, so what is the solution? For the thinning hair and the hair loss, there are topical treatments actually, medically, and in terms of your lifestyle. So we have the minoxidil solutions, finasteride tablets that can increase the thickness of hair. And if you increase the dietary component of fish, nuts, and seeds, you can actually reduce the chances that the hair will thin. But there's some people that have this as a genetic thing. You know, I have a friend in her 20s, she's having white hair. Now her hair is almost always, and we're about the same age. So sometimes it's that. But if you want, of course, we have the wigs, we have the hair color dyes, we have all sorts of things. So that's not a difficult thing to work out. Loss of skin elasticity. So this is where the skincare routine, the beauty industry is booming right now, but it works. It's evidence-based. So I'm going to quickly run through that for those that are interested. It does work. For men and women, there's nothing that says it's only a woman that wants to reduce skin elasticity. So if you are interested in skincare routines, the thing is inconsistency. It's not something that you see overnight, but you need to be consistent in doing this routine. So assuming, depending on your skin type, I'm just going to give blanket examples or suggestions, but you need to adjust it to your skin type. So number one is wash the skin, wash your face, whatever part of your body you're looking after. So you can use normal soap and water, or you can use a cleanser. If you have acne-prone skin, even within this age group, people still have breakouts, you can use salicylic acid containing cleansers. Then you should tone. So toners, what they do is to balance the pH of the skin so that when you apply the serum, whatever it is, vitamin C, retinol, or whatever, it doesn't irritate or undo the balance, the natural balance of your skin pH, and now increase breakouts. So some people, paradoxically, when they do skincare, they now have breakouts because they're missing some steps. So the cleanser, the toner, then the serum. So this is the time after the toner, you have the vitamin C serums in the morning and evening if you don't do retinol at night. So retinol is better at night. So what do these things do? They cause the body to produce the collagen that is being, is waning off with time. So it's like you are trying to hold back the dial of time, and the skin elasticity that is supposed to be reducing can actually remain the same, or actually decrease depending on what you do. So collagen, skincare routine, that is one. So skin care is not just skin deep. Everything else I've said is important as well in terms of lifestyle. So exercise, what you eat, how you sleep, how you manage stress. Reduce sensory ability. So this is time to check your eyesight. If you need glasses, get glasses, because squinting will increase the likelihood of wrinkles, and you are going to further along that age-related change than you would probably want to. Check your hearing as well, especially if you're used to listening to loud, noises, or where you work is just noisy. Then we talked about physical health challenges during the periodic health check. This is the time to screen yourself for all these things. Actually, you ought to have been mindful of this before now, so that you could prevent it. But it's not too late if you don't already have any of these things. Then if it's perimenopause, so this is something that I talk to a lot of my patients about. It's a frequent conversation we have. So what do I do about my moods? Is this all me, or is this hormonal? I'm really tired. I'm really always just tired. I don't have the zest. I'm not as motivated as I used to be. So we first of all exclude other things. So many other things can cause it. Thyroid hormones can be out of whack, for instance. It could be some medical condition. When we're done doing all that, then we can address the symptoms, because it might be perimenopause. So things like the exercise. So there is this adage I coined: energy begets energy. Talking about fatigue from perimenopause. So if you're tired and it's a hormonal thing, talking about estrogen waning, the tendency is to rest, isn't it? And to just take it easy. You want to do your morning exercise, so you take it easy. I counsel against that. We said we have excluded medical conditions. Rather, I would say, if you used to do like something vigorous, you can tone it down or do something. Because when you move, you actually increase stamina, increase energy, and increase your mood. So exercise can counter some of these changes that perimenopause will cause. But beyond exercise, there are some things that you can do, talking about if you have a cycle that has really changed and is really heavy and frequent and really bothersome, then you see your gynecologist, and most of them would have you insert a Mirena IUCD. So IUCD, intrauterine contraceptive device, it will release progesterone slowly, reduce the intensity of your periods, and make it lighter, and you're able to go along, go about your normal activities, and it's not that difficult. Then if you don't know all that, and the mood swings are still bothersome, the fatigue is still bothersome, we have meds that could help. Before we go into the hormonal replacement therapy, which I hardly do because of the side effects and the risks of cancer and the rest of that, I would typically do low dose paroxetine. So paroxetine is an antidepressant, but the dose we're given is not an antidepressant dose. So research has shown that low dose paroxetine and gabapentin would help, we take the edge off some of these perimenopausal and menopausal symptoms, especially the hot flushes. But the good news is that if you don't want to do meds at all, the hot flushes are the ones that will go with time. They're not like forever and ever you'll be experiencing hot flushes. Typically 51, 52, it will happen, and then 55, it's kind of fading away. So if you don't want meds at all, it will typically get better. Then for the men, what can we do about the andropause I mentioned? There is actually testosterone replacement, but again, this is like lower down on the list. Try everything else. Diet, exercise, lose the weight. Specifically addressing erectile problems now. Weight loss and being sure that you are of an adequate body mass index will do loads to increase erectile function. So once you've done that, so I don't even do testosterone or anything else until the person is of adequate BMI. And most of the time, when the person becomes physically active and they're losing the weight, everything reverses. It's like magic. So it works. Weight gain, the same thing, exercise. So people say, is there some weights, some exercise that you can give me that would target the abdominal area? Is there something I can do? So the answer is no. You have to lose weight everywhere and then target 2 abdominal exercises for you to have the abdomen you want. If you target the abdominal exercises, it won't work because the fat is on top of the muscle. And it's working, it's just that you're not seeing it because the fat has covered it. So you have to lose the weight and then do the exercise, and then you see the flat and the ripped abdomen. Then there are medical interventions for weight loss. So it is true, it's a fact that being overweight, being obese is beyond eat less, exercise more. We now know that the adipocytes themselves, the fat cells themselves, at some point they have a life of their own and they just begin to multiply. and they're getting bigger. So you are doing you're running, you're hitting the gym, and you're just getting bigger. So it is true that beyond weight loss and diet and exercise, losing weight is more complex than that. And that is why we're delighted, to welcome these new medical interventions for weight loss. And they are effective and they are relatively safe. Yes, you have to be screened initially to make sure to see what your body is like your gallbladder, your pancreas, your thyroid, and these are the things the organs that can show up the side effects. And if you have any family history of cancers and stuff like that, but most of us don't. So most people, it is safe. But the only thing is that before you start these medical interventions, talking about the semaglutide, the tirzepatide, once a week injections, so convenient, you need to have a lifestyle of diet and exercise. So it's not a magic bullet in that way, because for some of them, the side effects can be fatigue. So if you don't already have that lifestyle in place where you're moving and you're exercising, the fatigue from the medication, you will not lose weight even if you're taking semaglutide. So this is the reason why it doesn't work for some people, because they have neglected that foundation. You have to have that foundation of physical activity, then you move on to the medical intervention. So beyond the weight loss, these medications reduce your risk of hypertension. If you have hypertension, it reduces the number of pills you have. I actually have patients who have, beyond the drugs, people can do bariatric surgery as well. I have patients who have done bariatric surgery and they are off their antihypertensive, they are off their oral hypoglycemic. So yes, it does work. But you need to lose at least 15% of your body weight for you to see those benefits. And if you already have diabetes, it would mean that you reduce your risk of having cardiovascular problems or having chronic kidney disease, things like that. So these medications even reduce your risk of cancers. These medications are brilliant. We love them and they are available. We have semaglutide, we have tirzepatide in Nigeria. They're very expensive. One pen of semaglutide as of, this is June, as of early this month, went for about, I remember correctly, about 350,000 one pen. But the pen can last for about a month because you start at low doses and you increase. So it might be cost efficient depending on what we're looking at, especially if the person is already at risk of having these cardiovascular problems. So you're seeing diabetes, looking you in the eye, rising HbA1cs. I think it is cost effective. It is worth it to spend that money, get the weight off, and reduce your risk of things like this. So gradual muscle loss, we talked about the strength training. And I said incorporate it into your exercise routine about 2 to 3 times a week. So it doesn't mean you should do it every day, about 2 to 3 times a week, in addition to everything else I've said, aerobic exercise, flexibility, and the rest. What about the psychosocial challenges I mentioned? What about the slow processing speed I mentioned? It turns out there are things you can do about that as well. So a lot of times is that we don't know, not that there's nothing you can do. And you find people resigned and say, well, it's old age. Well, yes, it's old age, but there's something you can do. Physical activity, you see that it cuts across everything. I talked about mood and measuring physical activity. I talked about perimenopausal symptoms, I'm talking about physical activity. I'm mentioning cognitive and psychosocial challenges, again, physical activity. Do you know that physical exercise helps to improve your ability to working memory capacity, help increase cognitive health? It does. I actually wrote something about that. It's really intriguing, but it's something that we can all do and has so many benefits across board. So dual task exercises is when you are moving your body and you're doing something that requires you to think as well. So when you see people walking down the street and they're tossing a ball and walking, they're not just doing, they know what they're doing. They're doing dual task exercises. They are working out their minds and working out their bodies as well. If you don't want to toss the ball, get a partner to walk with, just with the person. You are talking and you're thinking and you're walking. It's very simple, dual task. And this is how you are slowing down that reduced memory capacity just because you are moving and doing something else. Now we'll talk a bit about mental health and stress. From the beginning I said, stressful generation, aging parents, older kids, wahala on every side. So it will be important to learn how to manage stress. So I always like to start from a daily me time. So I'm giving this presentation to different people at different times, and I always start from this. Why? Because if you're not even aware that you're stressed, if you're not even aware that you're intensely, you have intense emotions, you're angry, you're resentful, there's some bitterness, then how can you manage it? Because a lot of us are unaware. There's something called emotional unawareness. You're just living your life. Some people constantly live in survival mode. I really have patients like that. They're just moving, pushing through. One challenge comes one after the other, and they're pushing through. But they don't really access their emotions. Why? Because they're afraid of what will happen if they do. But if you don't, these emotions have a way of showing up in your everyday life. Your frustration tolerance reduces. You snap at the slightest thing. You're always angry, you're always irritable. You're not nice, you're not fun to be around. So you think you are on top of it, but you're not on top of it. Actually, you're giving way gradually and you don't even know it. So what I mean by me time, every day, as little as 30 minutes or less, spend time by yourself and scan through your whole day. Find out if there's any lingering emotion, any resentment, anger, sadness, anxiety, and that is how you become emotionally aware. Do it often enough, and you don't even have to bring out a specific time. You will just be so aware of your emotions as you go along. So if you are aware of your emotions, then you can deal with it. Another tip is to be mindful. So this sounds like a nice catchphrase, but it's really very important. So I'll walk you through what I mean by being mindful. So a lot of us live in the past, trying to blame ourselves for what we didn't do right, what we did wrong, and why we should have done this, we should have done that. Or we live in the future, we're worried about our kids, the future of this country, what we will do. And then as we're worried about the future of the past, our present is passing by. And our present is the life that we're talking about. So to be mindful means to stay in the present. Let the past be the past, let the future remain in the future. People who worry are worrying because they are trying to go into the future to anticipate what might happen and fix it before it happens, so it doesn't work, because they don't know what will happen. But then they spend their present doing that. So how do you stay in the present? So there's something called non-judgmental awareness. What that means is the problem with staying in the future, why we are dodging staying in the present, why we dodge staying in the present is because we have opinions about everything. We have expectations about everything. So non-judgmental awareness means take away that opinion and let the reality be the reality. An example, this is a patient's example, but it was just a very good one, so I'm going to give it. So we're talking about this in sessions, and she went home and she planned to take a nap. And her mom says, let's go for a walk. And she felt like there was this expectation for her to go for a walk with her mom instead of sleep. So she got angry. And the anger was like, I'm not doing what I want to do. So the non-judgmental awareness means remove your opinion that I'm not doing what I want to do. And the situation is, I want to sleep, mom wants to go for a walk. So when she learned to do that, she realized that it's not a big deal in going for a walk, I can still sleep. Or I can tell her, can we go some other time? And she became less angry. The emotion was not there. She looked at situations as they were, without coloring it with her own opinion and her own expectations. Just look at things the way they are. Another example is, I'm looking at all of you, oh, they look bored, oh, they're not enjoying what I'm saying. That's an opinion. I don't know that for a fact. But non-judgmental awareness is people are sitting here, looking at me and listening to this, and it sees a different experience altogether. So that's the first step, non-judgmental awareness. Remove your opinion, don't judge it negatively or anyway. Look at the reality as it is. Another tip or practice that will keep you mindful is to be effective. What does that mean? What is your goal in the moment? Achieve it and ignore the fact that you don't like this moment. So a lot of time we're struggling with things we don't like. This is not nice. I don't like that I'm getting older. Why am I getting older? Why am I not as strong as I used to be? This is not nice. This sucks according to my kids. So acceptance and being effective means, okay, there's nothing you can do about it. But what is your goal as you are getting older? My goal is to age gracefully. My goal is to achieve my purpose, to meet the needs of people that I want to meet their needs, to make impact so that my life will not just be in vain. The purpose that God brought me on this earth, I want to achieve it. That is being effective. So you are looking at your goals and you are leaving all the things that in the situation that is not pleasing. A good analogy is, imagine this ball machine that pushes out tennis balls to those that are playing tennis. So imagine that is life, throwing one challenge at you after another. So you don't like it. It's not nice. So to be ineffective is to stand there and begin to complain, oh, stop, I don't like it, stop, and then you're dodging and you're grumbling, right? To be effective means, well, I don't like that you're throwing balls at me, but I'm gonna get a bat and I'm gonna do my best to hit those balls so that you stop hitting my face. That's being effective. Another example is, imagine that you're playing a card game and there's millions of naira up for grabs, and they share you your card and your hand is not nice. And you look at it and you're like, how am I going to win this money with these cards? So to be ineffective is to say, you know what, I gave up, I quit, and then you're out of the game completely, no chance of winning. To be effective is, well, my goal is to win that money. I'm going to play the best I can. Shit this game, I will win. And then you do the best you can in that situation, regardless of the fact that it's unfavorable. So talking about mindfulness, so non-judgmental awareness, be effective. See if you can do one thing at a time. So this is difficult. When I say this, like, what about multitasking? So multitasking has been shown to actually not be effective. People who multitask end up doing a lot of things, but they are not effective as they would be if they did one thing at a time. So multitasking means you are doing different things at the same time. You will do it, but you will not do it as effectively as if you were doing one thing, finish it the next thing. So in terms of being present, if you are listening to a lecture, listen to a lecture. If you are answering a phone call, answer a phone call. If you are spending time with your husband or your spouse, spend time, be there, listen, look at their facial expression, be in the present, do one thing at a time. If you are with your kids, be with your kids. Even if it's for 30 seconds when you get into the house. Oh, mommy, oh, my darling, and then you greet. As you are greeting for 5 minutes, be there 5 minutes, full attention, and then you leave and go along your day. And then at each time, everything you're doing, focus your maximum attention. When you're trying to say hi to the kids and drop your bag, you are passing across a message that thing else that is distracting you is somehow competing with them for attention. Somehow more important than them. So talking about mindfulness, talking about how to, manage stress. Respond to negative self-talk. So self-talk is something we do all the time. We are running commentary on ourselves. We're giving feedback to ourselves. We're running. Okay. So, but you need to respond to them. If you don't respond to them, you build negative emotion. Gratitude and acceptance. I mentioned acceptance, which is non-judgmental awareness and be effective. Schedule activities that increase pleasure and mastery, just the way you have appointments to do work. So schedule work, schedule pleasure, schedule mastery. Hope ahead. So if you're envisaging a stressful situation, don't just wait until it happens. Imagine everything that could go wrong and fix it. In terms of how you would show up, how you would respond, how you would handle that anger or whatever. Then be assertive versus aggressive or passive. So communication, sometimes lack of communication is a problem, especially when we're talking about relationships. So the middle part is being assertive, where you are standing up for your own rights, you're speaking your mind, and you're not attacking the other person so that they are not defensive. Okay. So to achieve a work-life balance is to not just put everything you have into your work, but develop other areas of your life. Call it compartmentalization. So what are your goals and the other things that matter to you? In your friendship, family, volunteering, sports, contributing, what do you want to achieve, and what behaviors can you engage in that would help you achieve those things? Finally, talking about the spice I mentioned earlier, to relationships. So because I'm out of time, I'm going to spend time talking about one thing and just let you have the slides, just so that I don't, skip through in their facial expression or what they do. For instance, you are sitting with your wife or your husband watching a movie and she puts her head on your shoulder. That is the big, don't miss it. So to turn towards that is to hold her back, cuddle her. To turn away is to say something like, I bet your head is heavy. So you can turn towards and strengthen the relationship, or you can turn away or even against by making light of the situation or demeaning or speaking condescendingly. So we invite people to connect with us in different ways throughout life, especially those close to us. So our job is to identify those things and respond appropriately. For a kid, it could be mommy, and they look somehow. So that's an invitation for closer communication. You can turn to us and say, oh baby, what's wrong? I can be like, my friend, and then you move away. Things like that. So take home message. As we get older, we have our perks and our drawbacks. But you can do something to slow down the hand of time. You can do something to age gracefully. You can take care of yourself holistically. That increases the chance that you age the way you want to age by ensuring that you have a good work-life balance, maintaining a healthy lifestyle. You know, by lifestyle, I mean all those things I said. Prioritizing your mental health, talk about managing your stress, and then take care of important relationships by adding the spice we talked about. Thank you. Thank you for listening.
Thank you so much, Dr. Chika. Another round of applause, please. All right, so at this point, I think we will just accommodate maybe two questions. Two questions for anyone who doesn't have the first two hands for. Yeah, no hands, okay, already. Okay, let's go for gender balance, like one man, one woman, okay? Oh, no,
if you want to talk,
no question. Nobody's in the way. Yeah, okay.
Let's do two.
Let's do two. Are you saying, okay, two questions. All right.
We are here. We are here.
Okay, no, it's not fun. So let's take our first question.
Am I starting? No, you are not starting.
Holding the
Thank you. Thank you, Dr. Anireto. Anireto. That was a beautiful presentation. My point of emphasis has to do with stress. You know, as all of us here, we've reached the managerial position, and we tend to do a lot of things at the same time. The other day I almost bumped my house because of multitasking. I was at home, wanted to work from home, and I got a call from the hospital that they're doing promotion, and I jumped on the bike, and I went and I met a call from Subi, and that's. So these are scenarios that are very common with us at this stage.
Or make her feel certain ways to satisfy her in itself now make the man anxious and actually have the opposite effect. So what we did was reduce the expectation. So I had both of them in the clinic. So we said the goal is not penetration now. The goal is to be happy and enjoy each other. And you know what will happen when they're happy and enjoy each other? You will achieve your goal. So I just wanted to emphasize what I said, that it's not in the number of times, it's in the satisfaction that the couple gets and the intimacy that is built up. So beyond just, okay, we have to sleep together so number of times, it is how satisfied are we as a result, no matter the frequency. That in itself would strengthen relationships. And beyond that, some people don't say what they want sexually. It will surprise you, even at this age, people are inhibited, it's not socially acceptable, a woman should just get with it and get with the flow, you can't express yourself. But these things, when they're not brought to the fore, behind the scenes, they will affect her reaction to you, the man, in the sexual act. So communication, again, is key. Then the second question was about the prostate and intimacy. It is true that, sexual intimacy would help reduce the risk of prostate cancer. But it's a risk. We don't know exactly how many times that would cause this to happen, but yes, it is true.
On behalf of these distinguished gentlemen and ladies, we wish to thank you so much. You have actually impacted much on us this morning. You will not know what you have done, but I think this session is quite impactful, and it will go a long way in having a great impact on our performance, both at home and outside as we go out of this session. So thank you very much, and we also wish to have you one time again. We arrange that one.